dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunitz, and today our topic is the tobacco gap and what can we do about it. And my guest today is Dr. Albie Budnitz. He's a specialist in internal medicine as well as in pulmonology, and he is one of the main components of Dr. Koop's troops. So welcome, Dr. Budnitz. We're delighted to have you here. Tell us a little bit about being part of Dr. Koop's troop.
Well, thank you very much for having me. And I say one of Koop's troops with a tongue-in-cheek a bit, but Dr. Koop was a tremendous mentor of mine and was obviously our Attorney General in the 80s, and I think was the type of person that showed how we should do things. He saw the problem with tobacco and he saw the problem with HIV and tackled both of them despite his personal feelings. And after he finished being Attorney General, he was actually a pediatric surgeon in Philadelphia originally, but he went back to his alma mater, which is Dartmouth, and he started something called the Koop Institute. And it is still going strong. It's part of the Norris Cotton Cancer Center at Dartmouth, and he was active in it and active in an intelligent way right until his death 5 years ago in February at the age of 97. What I do with it actually is just help with program planning for our annual scientific meeting. And the Koop Institute now has actually turned itself not just on tobacco, but on population health. Of course, tobacco to me is a major part of population health, or unhealth, if you will.
And that's nationwide.
And that is nationwide, and New Hampshire is really a microcosm of what's going on in the nation, and I am active in some national organizations that relate to this, and we all have the ongoing problem.
And you have historically really been a leader in this field in the state of New Hampshire as well as nationwide, and really having a passion about tobacco. Dr. Budnitz, why are we still dealing with this? Why is it part of the health landscape, and why hasn't it changed? Why isn't it gone?
Well, it's changed to a degree, but the bottom line answer to that is nicotine, which is probably in a combustible cigarette. The combustible cigarette is being less used, which is good. But nicotine is a highly addicting substance, and delivered by the combustible cigarette. I say that because those are the old Marlboros and Virginia Slims that we all know and don't love. Delivers the medicine, which is nicotine, to the brain faster than just about anything else that we know. So if someone in the old days were smoking a pack of cigarettes, a pack of Marlboros has 20 cigarettes in it, 10 puffs per cigarette, that's 200 puffs. Each puff gets a hit of nicotine to the brain in less than 10 seconds.
And what happens to the brain?
And the brain is then stimulated to release dopamine, which is the feel-good drug. And the potency of that combination was shown way back in the 90s, actually by the National Cancer Institute, to be as addicting, if not more addicting, than the two drugs they were comparing were actually morphine and alcohol. And so the problem that we all see with nicotine now, in case we don't get to it, I'll get to that immediately, which is that if kids get exposed to nicotine, the developing brain changes, really its wires become hardwired change for their lives as in a way that they are susceptible to other substance use. And the problem with tobacco, and we really should call smoking tobacco use disorder because there's so many tobacco products out there now, which hopefully we'll get to some of the new ones, is that nicotine is an addicting drug. And if you get kids started on it, they are now open to use other drugs as well, alcohol and opioids specifically.
And we specifically in New Hampshire have a very large opioid problem.
True.
So where have we fallen short related to all the different programs that we've had related to tobacco from years ago and the education and trainings that have been done? What happened?
Well, tobacco first of all, has changed. All the kids know all about how terrible and disgusting smoking a cigarette is. And so our use of combustible cigarettes like Marlboros and Newports and Joe Camel, who isn't around anymore, fortunately, have changed. And we actually found out in another hat that I wear with the National Prevention Coalition, it used to be the National Smoke for Youth Coalition 20 years ago, that the kids in our high schools and the national high schools were 100% surveyed through the CDC's Youth Risk Behavior Survey. 5 years ago now, in 2013, their biggest concern was prescription drugs, and the biggest place they got it from was their grandparents. And that was a big concern and has remained so. And we are working through the Prevention Coalition with the other groups in town, the Mayor's Opioid Task Force and Boys and Girls Club and the Youth Council and the YMCA and PAL and all the other youth organizations in town to work on that. We've made some big inroads in the last 5 years.
When you say grandparents, not intentionally from the grandparents, unknowingly.
No, the kids think, gee, if Papa can take this, it must be safe, and boy, it makes you feel good. But so that was the problem that we realized after getting the data. We had to change our name from Smoke Free Youth Coalition to Prevention Coalition. But tobacco and nicotine is just still a part of that. And unfortunately, fast forward just 5 years, and in the last couple of years, really in the last 18 months, nicotine is a major problem with our kids again. And
Why?
And it comes from the latest development in what's called heated tobacco products, or that's the newest name. The name before that was electronic nicotine delivery systems, ENDS. The name before that was e-cigarettes, or the name that everybody knows is vaping, which is unfortunately a total misnomer because it makes it sound mild or not a problem. But when someone uses one of these heated tobacco products, the vape that they think comes out is actually an aerosol. And why that's important is because it gets all the way down into the lungs. And the newest products actually have less vape, as it were, that people can make all kinds of things out of. But they actually have a huge amount of nicotine in it. So there are actually now something called Juuls, J-U-U-L-S. We have somewhere along the way we have a slide on that. We can show you a picture, but it looks just like a thumb drive or flash drive or USB storage device. And it's made just like the other heated tobacco products with a lithium battery and with a little cartridge that stores liquid. In this case, they call it a pod. And each Juuls pod has an amount of nicotine, and I just mentioned 20 cigarettes per pack, 20 cigarettes. Wow. And kids are using these in schools to the extent that the Nashua High North teachers during their February break at their teachers workshop asked us from Prevention Coalition to talk about Juuls and about the brain and the problem with getting nicotine to the brain. And we don't know a whole lot about these except how much nicotine they have in them and whether they work as quickly as cigarettes. They probably don't work as quickly. It probably takes more than 10 seconds to get to the brain. But developing brain, meaning kids from anywhere from all the way up to age 18 or 20 in girls, 20 or 25 in boys, is much more susceptible to any of these substances. And nicotine is felt to be safe. Not sure why, but it's a good job the tobacco industry has done because 99.9% of our nicotine comes from tobacco. It's the only economical way to get nicotine. Synthesizing it is very much more expensive. If the developing brain can get addicted to nicotine with much less use of nicotine exposure than someone who's 25 or 30 or 40 years old.
And what is it doing to them physically,
So
mentally,
the brain,
and emotionally?
physically the brain, I don't know if I should go to some
ahead,
slides.
please.
Actually, can I go back just
Go
a
ahead.
sec? In New Hampshire, the New Hampshire Comprehensive Cancer Collaborative has said that about 2 years ago, said that there was a gap in that we're no longer funding tobacco prevention and control. And because of that, it reinvigorated my work that I do. Although for years, including this last year, 2017, the latest report for ALA, New Hampshire got an F, meaning failed, in funding tobacco prevention and control. We're right there with Kentucky and Tennessee and West Virginia. They have other reasons, like they grow tobacco, we don't. And also because we still allow people, we don't have a tobacco 21 law, meaning you could buy tobacco at 18 and above, as opposed to 21. So anyways, that got reinvigorated and it got people interested again and working on the gap to me is that, I'll go to the next one, is that everybody's worried about the opioids. You just said about that. We've had 400 or 500 deaths a year the last several years in New Hampshire from opioids, but we've had 1,900, that's 1,900 deaths per year from tobacco-related disease in New Hampshire each of those years. Not to diss opioids, but that's more than 400 or 500. And that's despite the fact that most people who use tobacco products want to quit. The other part of the gap is this whole heated products, and we'll talk about that a little bit more later. So I call tobacco actually a pediatric disease, and we should get rid of smoking cessation and things like that. But what do you think the average age of tobacco initiation and then I'll say tobacco use and then nicotine use and addiction is?
On the elementary level?
Okay, so give me a grade.
I would say...
Or an age.
An age? I don't know. I mean, you hear people and parents give feedback that some of the children are starting at age 7 or 8.
Yeah, that's absolutely perfectly correct. 7 to 9 is initiation. The average age of addiction is 14. And then those kids are hardwired forever to have issues with any substance use. And use of tobacco should be called, as it says on this slide, tobacco use disorder, and it is a pediatric disease. And interesting, the only other 2 MDs in the Coop Institute that are Dartmouth, that are stationed up at Dartmouth are pediatricians. Everyone else are PhDs doing research on all of this. And unfortunately, I still use Dr. Coop's slides. Cigarette smoking, even now, even cigarette smoking, even though kids are smoking less, our prevalence is markedly less. From in the 60s, it was almost 50%. In the 80s, it was about 30%, and now it's under 20%. So the prevalence of cigarette smoking is down, but our population is bigger. So there's still 35 to 40 million smokers.
Can you clarify that? Because before you mentioned that cigarette smoking from the physical point of view has come down, but you mentioned the other means of tobacco use. Has that gone up, like when you talked about the Juuls?
Markedly up. So and I'll have some slides from the National Prevention Coalition that we can maybe finish with, but the lines have crossed with use of combustible cigarette smoke going down and the use of heated products going up.
And from a health perspective?
Well, a health perspective, we don't know, absolutely. So we can't say that using heated tobacco products are as bad as cigarettes because we don't have the data. What everybody does agree on, and in different countries, in the UK and the EU, they look at this somewhat differently, but their epidemiology is different. Their use of heated products is different. But everybody agrees, including the UK and the EU and everyone, that kids should not be using these products because they can get addicted to the nicotine.
And they can easily be sold, these products. There's no limitation for their access.
Actually, good that you brought that up. New Hampshire was one of the first 6 states to make buying heated tobacco products illegal for those 18 and under. We were hoping to get everything moved up to 21 last year. That bill has been tabled but not killed, so it's coming up again next year. But despite that, because of online buying, and also you can walk around Nashua, there are at least 3 vape stores in Nashua on Main Street on 101A, and they say that they card people because it's illegal for them to sell under 18, but with flavors like creme brulee and cotton candy and things of that sort, kids are taking it up.
They're encouraging it.
And almost every high school kid and most middle school kids can show the specific data on that in Nashua know where and how to get heated tobacco products.
Now, you mentioned before that the educators were noticing that more and more of these things are being used. How are they seeing it? Because before you had rules in the schools, you couldn't smoke. There were no, they had to be outside a physical area in order to do that. Can they actually see the usage?
So what these things, they look like flash drives, and maybe I don't know if I can go way forward and then go back. Is that all right?
Of course
to do
you
that
can.
with slides?
Yes.
So I'll just go past and get down. This is the part of the gap. I'm just going to show you a picture of a Juul, I hope. There we are. So this is what an e-cigarette looks like. They have a million different forms, but inside they're essentially a lithium battery, a wire that the lithium battery heats up, and it heats up liquid in a reservoir of some type, a cartridge, or with the Juuls it's called a pod. This is a Juul, and if you look at it, it doesn't look much different than many flash drives.
Right.
And what you see at the bottom there is what they call the pod, which is their cartridge. That's what has 20 cigarettes worth of nicotine in it. And what the kids do is they pull out their flash drive and just suck on it and then blow it down, and it doesn't cause a big vapor, and they will sometimes go through 2 packs, 2 pods of these a day, which means they're getting 2 cigarette packs worth of nicotine. These kids are getting hooked.
Oh my
And
goodness.
what everyone will agree with is that getting them hooked on nicotine is not good. Not only is it that it's a gateway drug to other drugs, but also there's certainly data that suggests that kids who use heated tobacco products, especially things like this with a lot of nicotine, realize that getting a pack of cigarettes is much cheaper, and they can actually get the hit of nicotine quicker and more easily by smoking a cigarette. So more kids who use heated tobacco products who never were going to use anything necessarily then may go on. We don't have the data, it's not robust yet, to become cigarette smokers.
And is this data now being collected?
It is being collected, but
But the impact from a health point of view, you won't know until years down the road.
and that's the difference between opioids, since we talked about that, and tobacco products. Opioids kill people right then and there. They're young, and they see the impact. Tobacco doesn't kill people till you're old, like 40 or 50, or maybe 55. I'm being a little facetious because someone at the table here is a lot older than that. But in any case, the tobacco products actually affect every organ system in the body. And what the e-cigarettes do, we're not sure yet, but we are sure about the nicotine addiction.
Besides the Juuls, what else is there? There's something called ENDS.
So ENDS is just a name. It's called electronic nicotine delivery system, and the e-cigarettes I was starting to say before were only introduced in this country in 2007, and our law for kids not being illegal for kids to use it was actually passed in 2010, and there are so many different products. Let's see if I. So these are just some of the products of e-cigarettes and other tobacco products that are being used.
And then you have the hookah, the what?
Yeah, we had the hookah, but all the ones on the bottom you see there. But the ends are just an electronic nicotine delivery device. Some of them look like iPhones. Some of them look like cigars. Some of them look like pipes. They can come in any form. There are over 750 forms of ends, electronic nicotine delivery systems, or they just call it heated tobacco products now, that are out there with literally thousands of flavors. And one of the problems with the flavors is that the flavoring, they're using food flavoring, which has been FDA approved for food, for ingestion, but has never been studied for being heated and inhaled into the lungs. So we have no idea what this is going to do from inhalation standpoint.
I see. And the water pipes and the hookahs, now that has been used with marijuana for a long time, and it's also being used for nicotine?
Yeah, so hookahs, or we call them water pipes, coming from the Near East and the Middle East, have been around for a long time, and there's a lot of robust data on those. And they've been used with tobacco, and they actually cause all the problems that a regular combustible cigarette does, despite having, quote, water with it, despite having these wonderful flavors that you see up there, apple and banana and bubble gum and so forth.
And when you say all the problems?
All the problems that combustible cigarettes have been seen with hookahs and water pipes.
Okay, and that's affecting all parts of the body.
And therefore, it affects every organ system in the body.
So what needs to be done? Where do we need to go?
So we've denormalized cigarette smoking, so the prevalence has dropped remarkably, and the demographics have changed. So that we get rid of the whole thing, just like any epidemic. We have to change our strategy so that we can get at the people who are both smoking. That's on one end of the gap, is that there are smokers now, then there are electronic or heated product users. We don't want to start another whole generation of tobacco users with heated products, because we don't want them, we have a hook up there, hooked on them. And we want to help the rest of the 35 million smokers quit. So we have U.S. Public Health Service last updated in 2008, which is a while ago now, but we have well-documented, robust ways to help treat this chronic disease. Another way of looking at this, I'm trying to remember which way I go here, but yeah, I mean, tobacco use is a chronic disease, very similar to diabetes and hypertension and asthma, and it needs to be treated like a chronic disease. So any substance use disorder is a chronic disease. They can't just go through, get, for opioids again, they can't get naloxone and be saved for the moment, because they just go back out and come back in. Then it has to be attached to a recovery program, just like alcohol needs to be attached to a long-term recovery program, and tobacco use is the same thing. That's bad news, because it's tough to take care of chronic diseases. In some ways, I enjoy taking care of chronic diseases. But in any case, the good news is that we have the tools, and we've had them for years. We have 7 different drugs, and we have all kinds of counseling techniques. They're available to everybody, and we have the tools to make successful use of tobacco use, meaning that they're no longer using tobacco products of any type, as successful as treating diabetes or hypertension or asthma.
So how do people get help? Where do they go for that
The
help?
best way to get help, anybody to get help right now in New Hampshire, is to call 1-800-QUIT-NOW. And that takes a little bit of, I'll tell you what that is. And anybody can do that on their own. Our taxes are paying for it, so you might as well use it. So that's our quit line, and it's the same quit line that's used nationally. We purchase it, as it were, through our taxes, through our Department of Health and Human Services, along with Vermont and Maine and Massachusetts. And there are 7 vendors that in the country. We use National Jewish from Denver, so Massachusetts, Maine, New Hampshire all use National Jewish, and they have certified, trained tobacco treatment specialists available 24/7, 365.
Over the telephone?
Over the telephone. And there's good data to say it doesn't work necessarily as well as maybe one-on-one treatment or in person or group, but it certainly works as much better than people trying to quit on their own.
Do they do Skype interviews at all?
They
Skype assistance?
they actually will do all kinds of things with a person. So if you call 1-800-QUIT-NOW, they'll be happy to text you, to email you, to talk to you on the telephone. And what's nice is they work with the New Hampshire Department of Health and Human Services for the first, except for one other year in the past 40. The last 3 years we've had a little bit of funding. So we have quit kits that give you quit nicotine replacement therapy free for 2 weeks, as long as you keep up with the tobacco treatment specialist.
And that's through this program?
And that's for this program. They're called Quit Coaches. It has a few glitches, which I'm happy to briefly put in.
Please.
I took the slides out, but I don't answer any 1-800 numbers myself.
Okay, yeah.
So if I see that on my phone, I just skip it. But the numeric for the 1-800-QUIT-NOW is up there in parentheses, and we tell our patients, if you see that, you don't have to answer it if you don't want to answer the number. If you see that number come up, if let's say your doctor put in a referral and you didn't just call it on your own, call it back. So if you call it back, if you're doing it on your own, or the doctor's put in a referral, if the doctor puts in a referral, they will call you back within 24 hours, and they'll make 3 tries over 72 hours. Then they won't keep trying. But if you call them yourselves, or when the doctor puts in a referral and they call you, there are some glitches. There's a 5-second blank silence while a person, intake person, similar to what you get in many behavioral health departments, will talk to you and ask you a brief screening questionnaire to make sure that you're ready and willing to go with a quit coach. And if that takes about, that doesn't less than 15 seconds to fill that out. And then they'll get you a quit coach, but then there's a 30-second silence, which is a long time on the phone in silence, until they can find a human real person quit coach that'll be yours for the next at least 6 weeks, as long as you keep, working on quitting. And then you get a quit coach on the line. They figure out what would be best for you, what size patch, whether gum or lozenges, all those are available through Department of Health and Human Services, and they'll send it all to you free.
And you can be any age to call that.
That's a really good question. Right now, it's only tobacco's been illegal to be in possession of as long as I've been doing this, which is 45 years, and so you have to be 18 or older.
Okay, so this is important because you mentioned that it's a pediatric disease and it's a chronic disease. So the pediatricians now more attuned to looking for the signs and symptoms from the youth that they're working with that may be presenting with some of these problems, and then getting these children or these young people help.
Yeah, the pediatricians are definitely on board. At least in our town, I've talked to at least one of the very large pediatric groups, actually from about 6 or 7 different offices, about what we have available. And about the concerns primarily, just like with the National High School Teachers, of the brain changes that happen, and the pediatricians are well aware of that.
Okay.
And I think the reason that the Coop Institute's only other 2 doctors besides my MD doctors in it are pediatricians is because they've been aware of that for a long time.
So if you go to 1-800-784-8669, which is Quit Now,
Yep.
you can get free services, free coaching, free supports to help you quit.
Absolutely. And it's free services, counseling services, and support in the way of nicotine replacement therapy, 3 of the 5 drugs that are available, 3 of the 5 nicotine drugs that are available for up to 6 weeks. And they do keep on your case, and the data is robust that this will between double and triple your success at becoming smoke-free and in long-term recovery.
That's critically important. So it's a self-referral at 1-800-QUIT-NOW, 1-800-784-8669. Thank you very much. Until next time.